All right, it's that time of week when we take your medical questions and get answers from local doctors. We are joined now by Dr. Amy Cobb with University Health. Thanks for being back on the show.
My pleasure.
So first question is about seasonal affective disorder. What is it, first of all, and what are some of the ways to treat it? And we were talking right before we came on here about this is a thing in South Texas. You might not think that it is, but it is.
Right. It's definitely more common in the north, but it can happen here. So seasonal affective disorder is a subtype of depression that can happen during certain seasons. Most commonly, it's fall and winter. And the interesting thing, and the reason I think it's important that people know about this, is the treatment does include the usual stuff like therapy and healthy lifestyle and medicine, but actually light therapy is very effective for this.
Interesting.
So you can buy a lamp with, that you sit in front of for 20 to 30 minutes a day. In the mid part of the day, about 12 to 2:30 is ideal. And you can also consider a dawn simulator, so sort of a lamp that gives off the same frequency and brightness as a sunrise. And those therapies, that light therapy, can help lift your depression within 1 to 4 weeks. And I just had a patient with this yesterday who came in, and we were talking about, this is an amazing tool that she has because every year she suffers with depressive symptoms.
And now she knows what it is.
Right. Yeah, she has a name for it, and it doesn't seem so mysterious. They're like, gosh, why do I always get so down? Is it that I don't like the holidays? It's really about the weather.
So the lamp, is it a specific kind of lamp? I mean, we're not talking about your average desk lamp.
Right. You can put in, just search, for seasonal affective disorder lamp, and you'll kind of come up with some of the ones that have been studied for this.
Okay. Great. Next question. Many schools planning spring parent-teacher conferences in the coming weeks. What evaluations may be needed if a parent or teacher have concerns about a child's learning?
Right. So the first thing you're going to want to do is check in with your local public school because they can test for learning disabilities. That's really where you're going to get that diagnosis of dyslexia and some of the other learning disabilities related to math or writing, etc. From there, if you're concerned especially about your child's attention or impulsivity or trouble remembering things, that could be a symptom of attention deficit disorder or attention deficit hyperactivity disorder, which we call ADD or ADHD. And that can be diagnosed by your pediatric provider. Some people think you have to see a specialist, but if they're 4 or up, your pediatrician can actually diagnose and treat ADHD or ADD. If you're worried about, or if there might be signs of something like autism or another developmental difference, maybe intellectual disability, then it might be better to see a psychologist, like a clinical psychologist or a pediatric developmental specialist for specialized testing. But a good start would be definitely you want to contact your school district, and you want to do that in writing, saying, I'm concerned about my child and I want them to be tested, and then check in with your doctor.
Yeah, and if you have any doubts, do it. I mean, you have to advocate for your children.
That's right. And the earlier you intervene, the less behind they get, and so it can pay off in the long run.
Yeah, you bet. Okay, so the next question we have is about heart palpitations. What are the best medications for heart palpitations?
The answer to this question hinges on what's causing them, right?
Yeah.
So you can be dehydrated, stand up quickly, and get a heart palpitation, and then you're going to need to drink water. Some other common things might be anemia. So if your anemia is due to iron deficiency, the best medicine might be iron, right? Thyroid disorders can cause palpitations, so you would want to get a blood test and then potentially be put on a thyroid medication. Anxiety is a very common cause of palpitations. It's probably the most common one I see because people come in to see the doctor and they get nervous, right? And so then we want to go down that line of how we treat anxiety. But if it's from the heart, what you're going to get is an EKG to check the rhythm and to define, is it an arrhythmia or is it just a normal rhythm that's fast? And then that decides what kind of medication you might need. So it's going to be a check in with your doctor to get to the underlying cause. And don't drink caffeine if you're suffering from this.
Yeah, if you're worried about it. By the way, January is Blood Donor Month.
Right.
We have a blood donation question. This person says, I'm HIV positive, was wondering if I can donate blood to another HIV positive person.
Yeah, so the short answer is no. And the reason is not all HIV strains are the same. They're actually different genotypes and different drug resistance patterns. So you might have HIV with resistance to drug A, and then if you have a donor with resistance to drug B who donates to you, you now have what we call a super infection that's harder to treat.
Yeah.
So I would encourage this person, I mean, I love that they still want to help save lives and give. One idea I had was, get involved in a Know Your Status campaign, right? And so this is the campaigns that say, all teens and adults are supposed to be tested for HIV at least once, regardless of risk factors. And then if you have risk factors, you're going to want to be tested more often. And so they could share their own story of how they were diagnosed, maybe what treatments they've had to help with the stigma. And the other thing that I would just call out is they did revise the donation restriction guidelines last year. So it started with the FDA, and American Red Cross adopted it as well. It used to be that if you were a man who had sex with men, or MSM, you couldn't donate blood, or even a woman who had sex with a man who had sex with men couldn't. But those sexuality-related restrictions have been lifted. So it's really about high-risk behaviors, not sexuality.
Yeah, we talked about this just yesterday here. There's so many questions about who can donate blood with their, even travel histories, not to mention physical conditions. So best thing is just to call and ask questions to several local blood banks.
Yeah. And if you have a question to ask, we'll ask it.
I know, send it to us.
A QR code want to show you right now. If you have a question for Doc Talk, you want us to ask Dr. Cobb, for example, this is the QR code that you can scan and submit your questions right here to us. We take your questions. It's our segment, but they're your questions.
Dr. Cobb, thank you.
My pleasure.
We'll see you next time.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.